En PAM Health Rehabilitación Hospital de El Paso, una asociación con la Universidad Medical Center, nuestro objetivo final es infundir esperanza en nuestros pacientes y restaurarlos a su nivel más alto posible de funcionamiento. Nuestro hospital cuenta con 42 habitaciones privadas con un amplio gimnasio terapéutico. Personalizamos nuestros planes de atención para cada paciente para poder ayudar a satisfacer sus necesidades específicas.
The role of a physician in an inpatient rehabilitation unit is to ensure that the patient remains clinically stable in order to participate in an intensive therapy program consisting of 3 hours of physical, occupational, and/or speech therapy. Our patients may have conditions such as coronary artery disease and have had a recent cardiac bypass grafting, or we have patients that have pain after a hip replacement or a knee replacement, and we have to ensure that those patients are able to participate in therapy, meaning that their blood pressure is being monitored and controlled, their pain is controlled, and any other medical condition that they may have receives optimization of treatment.
We have a variety of patients that come to our hospital from different kinds of settings. We get them from acute hospital, we get them from assisted living facilities, from surgical centers, and sometimes from home. And they'll present to us with conditions they're recovering from, like spinal cord injury, brain injury, orthopedic conditions, amputation, surgery. On a fundamental level, we're trying to get them to their highest level of independence. Physical therapy will work with mobility, like walking. Occupational therapy will work on activities of daily living, and speech therapy will work with communication, swallow function, and cognition.
My mother suffered a stroke, and being here at this hospital has definitely been good for her recovery. She's gotten excellent treatment. I think they've been very friendly, and I think that's a big part of her recovery, is definitely being surrounded by friendly people who are always willing to help her.
We are very lucky to be connected with the inpatient rehab. So those patients who are here for maybe a week or 2 or 3 can then come down and it's seamless. They recognize the facility. They're seeing those same faces that cared for them while they were inpatient. We have an expansive facility that allows us to have an array of patients and folks that come in, everywhere from peds with sports-related injuries to scoliosis to adults with joint replacement, chronic pain, different types of neurological conditions, both acute and chronic injuries. And so we're well suited to do that.
Since I've been here, the inpatient, it was great. But the outpatient therapy, it is super. I walked hunched over like this. And I walked like this for like a decade. I don't walk like that anymore. I stand straight up. I feel like a brand new person. I look like a brand new person. Everyone gives me compliments. I put on a dress that I hadn't worn in 14 years, and it looked marvelous.
My goals will always align with the patient's goals and that of their family. So it's great to be that cheerleader, so to speak, in the patient's corner, wanting to see them succeed and working with a team of professionals who also have that singular goal in mind, which is to help the patient be more independent.
PAM Health y la Universidad Medical Center se enorgullecen de asociarse para servir a nuestra comunidad de El Paso.